Welcome to the MPC Chemical Productivity Nexus webinar series 2021. Firstly, I would like to congratulate the attendees for having the courage to keep on learning, upgrading your knowledge and skills despite MCO 2.0. Vaccines have arrived and hopefully it will be applied safely to create the herd immunity that we urgently need. Great Britain has reported 70% effectiveness thus far after the first shot, and hopefully the good news continues. Ladies and gentlemen, the field of toxicology in the chemical industry plays a vital role in developing a wide range of effective and safe products, including petrochemicals, medicines, pesticides, cosmetics, food and drink, and household products. Industrial toxicology itself is the study of the harmful effects on humans by chemicals used in the workplace, the products produced by companies, and the waste created in manufacturing. Many, I think, can still remember where more than 5,000 people, mainly children, were affected by the incident in Sungai Kim Kim, Pasir Gudang, where they were rushed for treatment after having breathing difficulties, nausea, and vomiting from the exposure to the toxic gases at schools. Exposure to occupational and environmental contaminants is a major contributor to human health problems. And according to doctors in clinics, moderate to severe asthma are among the mostly attended cases. Inhalation of gases, vapors, aerosols, and mixtures of these can cause a wide range of adverse health effects, ranging from simple irritation to systematic diseases. Despite significant achievements in the risk assessment of chemicals, the toxicological database, particularly for industrial chemicals, remains limited. Today, we are going to look into the basics of toxicology. Our speaker for today is technologist Dr. Ismaniza Ismail. She is a senior lecturer at the Center of Studies for Chemistry and Environmental Faculty of Applied Science, University Technology Mara, or UITM. She is a professional technologist in the field of chemical technology, recognized by MBOT, and obtained a PhD, right? Obtained her PhD in Occupational and Environmental Hygiene from the University of Adelaide, Australia, Master of Biotechnology from Queensland University, Australia, Bachelor of Science Honours Environmental Technology from UITM Shah Alam, and a Diploma in Microbiology from UITM Shah Alam. She is a committee member for University Liaison for the Malaysian Industrial Hygiene Association, or MIHA, and is also actively involved with the Malaysian Society for Occupational Safety and Health as a trainer and speaker for the mentoring program. She is also appointed as a subject matter expert by other universities and by the Ministry of Health for the National Environmental Health Action Plan. Dr. Ismaniza has a profound interest in the area of occupational safety and health, including industrial hygiene and environmental health. She has been involved in various research in different workplace settings, looking at exposure assessments and risk assessment and control, exposure assessment and industrial safety. Ladies and gentlemen, without any further much ado, I would like to hand the presentation to Dr. Ismaniza Ismail.
Okay, thank you very much, Cik Helmi, Mr. Moderator. Right, good morning and Assalamualaikum warahmatullahi wabarakatuh to all of you. Right, thank you very much for the lengthy introduction. Okay, today, as Mr. Moderator has just mentioned, we are going to go through our first session on basics of toxicology. But I would also like to emphasize.
Yeah.
Yeah. Can you hear me?
Saya tak boleh nak live kan? Oh, kena discussion. Yeah.
Any issues? Okay, good.
Okay, by the way, ladies and gentlemen, you can download the slides for the presentation by looking into the chat corner, right? There's a chat area on the right-hand side of your screen. And shall there be any questions? You can also write your questions at the chat area or the chat box, and I will somehow try to convey that question to the presenter, and she will answer the questions for you, right? So presentation slides and also questions on the chat box at the right-hand side of your screen. Okay,
Yep.
all right,
Shall I
so
proceed?
yeah, please.
All right, okay. So this is the first series of several. Okay, and we will begin with basics of toxicology. Okay, so to those who have enrolled, who have registered for this, might also want to look at other opportunities registering for the upcoming sessions. Okay, because then from there you can see the continuity from one session to another. All right. So if you're ready, I think let's get going. All right. Toxicology. In the 19th century, actually, there were a little bit of confusion in which needle grinders. Okay, so those years when people make needles, they have to grind the ends of the tips of the needles. Then, so they thought that they were exposed to metal splinters. Okay, because when they get some diseases, they thought that they had been inhaling metal splinters. Whereas actually later on, it was discovered that actually they were exposed to silica from the grinding wheels itself. Okay, so from there we can see that it is very important to understand how our body interacts with the work environment. What are we exposed to? Okay, and from there only we can understand the damaging effects that it causes to our body, right? And it can also help us to understand better in terms of how our body responds to it. For example, maybe X-rays. Okay, X-ray is a curious phenomenon in which we know that it is useful, okay, in medical field today, but it is also carcinogenic. It can cause cancer. Okay, so learning toxicology can make us understand all these things, and it can also assist us in preparing the control measures for preventing damage to health. All right, a little bit back on the history. Okay, long ago, okay, people realized that there have been prevalence on scrotal cancer, okay, among chimney sweepers in England. Okay, and then some toxicologists, well, they were wondering, what's the problem? Why is it only related to chimney sweepers? So in England, there were chimneys, so it has to be clean every now and then. And then only they realized that there is an association between the cancer and, actually the black soot that is inhaled by the sweepers and from the chimney. So when they clean it, the black soot will come, falling onto the floor. So, well, that is the process when they inhale it and it causes cancer. Right. There's also another one, which is phossy jaw. If you can see this picture here. Okay. It is called phossy jaw. It looks like that due to the exposure to phosphorus. And it was very common among matchstick makers. Okay. Well, fortunately, we don't have this kind of jobs anymore nowadays, because nowadays we work in various work environments which we consider as safer and healthier. Okay, we may be working in construction sites, in the labs, in factories, okay, in offices. Okay, but that does not mean that we are safe from all these hazards. Okay, for all we know, actually we are exposed to something, whether we can see it or not. Right. There's this guy, a scholar, a Swiss scholar actually. He's called Paracelsus. That's his nickname actually. He is known as the father of toxicology. And what he coined that time was all substances are poisons. According to him, there is none which is not a poison. Right. So it is pretty much like salt or sugar that we take nowadays. We do take salt in our daily diet. We consume sugar, okay, in our drinks. But it's just what matters is that how much do we put in our food or our drinks. Okay, if we put too much, then it will cause, well, it will become a poison that can cause diseases. Okay, so that is the similar concept that was introduced by Paracelsus. Okay, and he also described on acute and chronic poisonings, the short-term and long-term exposure. Okay, among workers like smelting workers, okay, metallurgists, okay, and other jobs that relates with mercury. All right. It is very important for us to understand causal relationships. Okay, when we talk about how all these toxic compounds can cause diseases to us, we have to understand that our body may respond the same way to different exposures. Okay, for example, if you have asthma, okay, that can be because you are exposed to pollens, the bunga, maybe you are allergic to pollens. Okay, lalu you just pass by a garden, okay, maybe you inhale it and you have hay fever. Okay, but also bear in mind, okay, that it could also be due to exposure to dust or small particles. Okay, it could be to mist, fogs, smokes, and so on. Okay, depending on your job description. Okay, if you are dealing with, you know, tiny powder of chemicals, okay, cements, wheat flour, and so on, right? And another example is headache. I guess it is pretty common nowadays that we have headaches, right? It's just that whether we take it seriously or not. Okay, chances are that we feel like it's just headache, it's just one of the things. Okay, that could be due to exposure to carbon monoxide. Okay, because carbon monoxide, when you are exposed to it, it will, the oxygen that is carried by our red blood cell will be halted. So that means that, our body does not get the oxygen that it requires. Okay, but do not overthink juga lah, right? Because it could also be due to dehydration only. Okay, or maybe, you are just annoyed by noise that you are exposed to. So in this case, you have to, weigh accordingly whether it is due to exposure at workplaces that could be too much, or it's just maybe environmental factors. Okay. All right. There are health effects that are related to particular events. Okay, it can be very subtle, it can be very simple, such as mood swings. Okay, sometimes you just feel like just grumpy at one time, happy and sad. You laugh at one time, so you seem like a crazy person. Or maybe you have memory loss. Okay, you forget whether you have locked the door. Okay, you have locked the car or not. You keep checking every now and then. But to you, it's just one of the things. Okay, but bear in mind that could also be due to exposure to, any compounds or toxic compounds at your workplaces, right? Similarly, we also have something that is more severe, okay, like lung cancer, for instance. That could be due to exposure in mining, okay, if you're a miner, or could also be due to smoking. Okay, so I don't see why sometimes smokers make it a big fuss as if my goodness, I am exposed to, all these things, haze, when haze season comes, they make it a big fuss, wearing masks, this and that, whereas they are intentionally exposing themselves to all these toxic substances that can cause lung cancer anyway. All right, before I proceed, I would like to encourage you to, post questions if you have any, right? And I will be interrupted by the moderator, yeah, if there are any questions. Okay, because if we wait until the end, okay, maybe you will forget the questions that you want to ask. Okay, so feel free to ask questions. All right, for all these things, if you want to, solve the problem, you have to understand all these factors that you said here. You have to understand what are you exposed to. For instance, I may work in an office setting, okay, but it doesn't mean that I am free from exposure to toxic substances. Okay, indoor air quality is also an issue. There could be dust, there could be, leakage of, the aircon system, okay, things like that can also affect my health, right? So if your job description requires you to expose you to chemicals, for instance, okay, you have to know what type of chemicals. Are they toxic enough, or are they just, harmful, or are they, the classification, yeah, right? And all those things, the toxicology of materials, can be obtained from the labels of the compound that you deal with, okay, or maybe from the safety data sheet. Okay, and from there you can read on the health effects. Okay, what can it cause? How can it affect you? Okay, and what are the emergency response in case, you know, if it splashes into your eyes, in case if you spill it onto your hands, and so on. All right, and you also have to understand.
One question out of curiosity, doctor. Suppose that a person comes to report for work, right? He's a newcomer or she's a newcomer. Now, where can all this information be obtained regarding the company, especially with regards to the toxicology of materials? What
When
is your
or where?
advice? When, or yes, both. I think when before, prior joining, or during joining.
Okay.
What would be your advice?
All right. Typically, it will only be made available once people join the company, right? Because that can be a, well, you know, like not a trade secret, but something like that. It's like, you know, before you join us, you shouldn't know what is the setting like, what you may be exposed to. But once you join, you have all the rights to know what are you exposed to. So you can always query. You have your rights to demand for safety data sheet to be presented to you. Okay, it should be made available. Say in the labs, there should be a file that compiles all the details of chemicals in the lab, for instance, okay, that you deal with. Labels should be clear. All right. So that is when and where. Does that answer your question?
Okay. All right.
All right. Okay. Besides that, you also have to understand the effectiveness of control strategies. Okay, I would like to share this with you. I think last few months, I went to a company and after a walkabout in that factory, we had a chat with the manager of the company, and we insisted that, you know, we conduct a chemical exposure monitoring, okay, to understand how much are the workers exposed to that toxic substances. Yeah, I cannot reveal what toxic substances. Anyway, he emphasized on, okay, what's the problem now? Because I have provided the workers with face masks. I think it's all good. Okay, whereas actually it's not. One is the type of face mask. Okay, you have to know that it's, you know, it's been well maintained. Okay, and the work environment should also be good. Okay, because the situation at that time is that although they were provided with face masks, there was a fan blowing air, okay, towards the workers. That is just to provide comfort to the workers. But in a way, it can also spread all the, you know, the dust to be inhaled by the workers somehow, or it may also settle down onto the skin of the workers. So you have to understand the effectiveness of control strategies as well. Okay, and the relative cost of implementation is always of concern to the bosses, especially. Okay, to the workers, it's like, okay, whatever that's provided, we'll just use them. Okay, and effective risk communication. Okay, bosses cannot, bosses in this case are managers, the employers. Employers cannot simply just provide PPE, okay, and then assuming that the workers would know how to use them. Okay, they will have to make sure that it is well communicated to the workers on how to use them, when to change them, so on and so forth. Okay, I should not elaborate further because that topic on PPE will be in one of our sessions, you know, in the series. Okay, so please enroll if you are keen to know more. Okay, occupational disease and injuries can differ depending on several factors. Okay, it depends on the time, okay, how long you are exposed to it, okay, and how long can you see the effects. It can be immediate effects, or it can take a longer time. Right, it can also differ depending on the damage factor. Okay, it can be subtle change, like I said just now. It can be just mood swings. Okay, it can be headaches. It can be, you know, something more severe, like it can affect the systemic blood system, gets into the blood, it affects the organ, and so on. And of course, the dose. Okay, dosing, we will explain further on this later on. All right. So now we have come to what is toxicology. All right, toxicology is basically the science of poison. Okay, or it can be said as a study of the effects of a substance on living organisms. And living organisms, by this we mean humans lah, right? Although living organisms also refers to animals, okay, plants, okay, but animals are used for us to study on the effects on human beings. Okay, I guess all of you are aware of the use of mice, okay, white mice, rats, kadang-kadang dia pakai guinea pigs, they can use monkeys, they can use pigs, okay, animals, mammals lah typically, that is representative of human body system. Okay, so because sometimes it is unethical to test it on human beings, so that is why animal toxicology comes in place. All right. In toxicology, it is very important for us to understand the concept because we need to understand the exposure standard. Okay, how much is much? Because you may be exposed to vapors, okay, ataupun to welding fumes at work. Okay, but you have to know, is this above the limit or not? Okay, so you have to understand that. The second one is you have to recognize and prioritize chemical hazards. Okay, because some chemicals may not be as harmful as the others. Okay, so it is important for you to know that, and also to determine the control measures. Okay, PPE is always said as the easiest one to be implemented, whereas actually it is the last resort of the hierarchy. Okay, there are other hierarchy of control measures like elimination, okay, substitution, isolation, engineering control, and so on. Okay, that will also be covered in one of our series later on. Okay, and it is important for us to understand all this because, for example, if you work in a foundry, you may wear a mask for dust, okay, to cover your respiratory system. Okay, but at the same time, you may also be exposed to isocyanate vapor. Okay, mind you, dust and vapor, those are two different types of things that we can inhale. Okay, and of course, when they are two different types, it means that the protection afforded by PPE are different. So for that kind of exposure, what type of mask should we use? Which of these you think is the best? Right? So it's very common nowadays that we wear this surgical mask, but that is for exposure against the virus. Okay, right? But what about all these? Okay, these two are actually for dust. Okay, and these are for gases and vapors, cartridges. Okay, so you have to understand that, otherwise you will be wearing the wrong type and it doesn't provide you protection. Okay, so it's just like when you are exposed to, during the Sungai Kim Kim incident, okay, people were so worried and they have started to wear, surgical masks. And I was like, bila tengok all the news, macam, okay, this is not protecting them. This provides false sense of security, which is not good lah sebenarnya. But, some people feel like it's better than nothing. Well, so I leave it to you guys to interpret lah. Okay.
Doctor, when
Yes.
you mentioned about the animal toxicology, right? Meaning to say to see the effects of the toxin towards animals, is it part of the stages to define whether the toxic level is hazardous to human being? Because you see, when we do the vaccination evaluation, right, there are 3 stages before it reaches the mass. So is it the same for the what do you call this animal toxicology or toxicology aspect?
Yes, it's pretty much the same, I would say, because even if we want to conduct it on animals, we still have to undergo ethics approval. Okay, we have to make sure that we are ethical, that we sacrifice the animals in an ethical way. Okay, and we do not let them suffer. Okay, we will test only on these compounds that is stated in the study. Okay, to this particular dose, it shouldn't be exceeded. As explained in the proposal, things like that lah. Okay, like my case, when I did my PhD, it was on skin studies. So if I didn't get donated human skin at that time, I can always use other types of skin. I could use pig skin, I could use monkey skin, but I was lucky at that time, someone donated their human skin. So, but still, human skin is, kalau, when it involves human, typically it is very hard to get ethics approval. Okay, who would volunteer themselves? Like, all right, because I do get this response when I presented my work. Why do you test it on donated human skin that it has been cut off the body and then you test it? Wouldn't it be nicer if you test it on human beings skin yang macam it's still intact on our body? But I guess no one would be willing to do that. Okay, who would want to? Okay, please test it on my hand, on my skin, okay, because the impacts would be experienced by the whole body. So the best thing that we can do is by testing it on animals lah. Right? Okay. Good question. All right.
All right.
For toxicology, it is very important for us to study it qualitatively. Okay, qualitatively is just by having a rough idea of what hazards is caused by what substances. Okay, what are the effects? But quantitatively is for us to understand how much. Okay, we want to quantify exactly, right? And it is also important to investigate the occurrence, nature, incidence, mechanism, and risk factors. And this is typically calculated by hazard times the exposure. If you are exposed to something that is super hazardous, but the exposure is very low, okay, or maybe very rare, then may not be of high risk lah. Okay, but if you are exposed to it often, like on daily basis, and maybe for 8 hours per day, okay, then you might be, you should be more concerned lah of the risk that you are exposed to.
Okay, doctor, there's a question from Cherry, Sarawak.
Yes, please.
Now, the lead is found in food, lead. But may I know, how do we know the level of lead consumption that can cause toxicology to human?
All right. This is not of occupational punya setting, tapi, all right, anyway, thank you very much for the question. If you want to know how much heavy metals, okay, not necessarily lead only, it can be tested in the lab actually. Okay, there is no way that we can simply tell that, just by looking at it or just by, weighing it like that. Okay, because it is contained, it is embedded in whatever that we eat. Okay, as simple as shellfish, seafood. Seafood contains a lot of heavy metals, right? So it is up to you. Now that you know the facts, if you haven't known before this, it is up to you how whether you want to consume it in a small amount or you don't want to consume it at all, or you still want to consume it. Okay, it is your personal decision. I myself, I know that oyster is a good heavy metal accumulator, but I enjoy eating oysters. Okay, pucuk paku similarly, is good at accumulating all those heavy metals as well. But we do consume it sometimes. But how much is much? Okay, that depends on the accumulation lah. Say if it is grown on a soil, on a piece of land that contains a lot of heavy metals, it means that it will absorb a lot more. Okay, it depends on the environmental setting of the plants ataupun of the animals yang ada kat situ lah. Right? I hope that answers your question. Okay, so now you may still wonder, how else can we be exposed to all these toxic substances? All right, the first one is by intentional ingestion, right? And the picture explains lah. So if you are a smoker, chances are that you will intentionally put it into your mouth while maybe by doing your work, okay, or after doing your work, after spraying pesticides, ataupun after working in the lab, handling chemicals, maybe you forget to wash your hands, okay, ataupun you purposely didn't want to wash your hands, okay, and that can also be by occupational exposure. Occupational exposure ni, I would say is nak kata preventable, yeah, it is sort of preventable, but like it or not, because you choose that job, okay, so you will be exposed to it somehow, but it has to be controlled by the employers. Okay, the employees provide solutions to you, SOP ke, work procedures ke, and you have to follow. Okay. The third way that you can be exposed to it is by environmental exposure. You may not work in that kind of work setting that exposes you to chemicals, okay, but you may be, you may go out, okay, you may inhale smokes from vehicles, okay, automobile punya emission, okay, so by hook or by crook you will still be exposed to it. Okay, during the hay season, I was made to understand in Indonesia now they have identified hotspots. That was 2 days ago. So chances are, we should welcome the haze anytime soon, right? So that is environmental exposure lah. All right, the third one is accidental poisoning. All right, accidental poisoning is pretty much like, when you have cleaning products at home, okay, and then maybe it can be reached by little children, okay. So you have to make sure that it is well locked so that if it is not the children pun, it can be ourselves juga, because maybe we touch the toilet cleaners, okay, after cleaning the toilets, but we forgot to wash our hands, right? And last but not least is the, sorry, I can't see it because it's blocked by my own intentional poisoning, sorry. Okay, so intentional poisoning is when you commit suicide lah, okay, by putting in something into your body that can affect your organs and so on. All right, so look at this picture. This is a picture of a worker spraying pesticides in a paddy field. Can you tell me what is the route of exposure to this worker? How does pesticide get into his body? How can he be exposed to pesticide? Okay, any answers? Any answers on the chat box, girl? Your mic is off, tell me.
Some said that is inhalation or ingestion, skin, occupational.
All right, good. All right, because typically, thank you very much. Because typically people would feel that pesticide exposure is by inhalation only, okay, because of the stench. Kan pesticide ni kadang-kadang it is not necessarily smelly, dia tak sepatutnya busuk pun, but they add the stench just to alert people on the hazards that it brings along with it. Okay, but if you look at this guy wears a long sleeve shirt, maybe just to minimize skin exposure. Okay, he does wear this kind of respirator, which is of a good type, okay, for gases and vapor. But it is not covered, that doesn't cover the neck. Okay, well, maybe there's no way to do it. Inhalation, apa lagi? Ingestion. So maksudnya he will have to wash his hands after he finishes his task. All right. So basically, there are 4 routes of exposure. The first one is by inhalation, in which it goes through the nose, okay, and gets into your respiratory system. It can also be ingested. Okay. It can be absorbed through the skin, okay, not necessarily hands, okay, other surface of our skin as well, and also through the eyes, okay, and also by injection. Okay, injection ni selalunya kalau accidents lah, accidental injection. All right, so it is very important for us to understand the pharmacokinetics of what happens to the toxic compounds when it gets into our body. Right, it is also called bio. Okay, so if you consume something, or if you are exposed to something, not necessarily consuming like intentional. If you inhale something, okay, that is toxic to your body, it will be absorbed into your body and it will be distributed throughout the body. Okay, so distributed ni, it will choose its preferred organs lah then. Okay, that is called biotransformation. Okay, and then it will be metabolized possibly. Okay, metabolized, it will be broken down, or it may still be as is, okay, in our organs, in the liver, in the kidney, okay, and so on. And last but not least, it will be excreted. If it is excreted, okay, but not necessarily ada yang it will stay in the body. So basically, this is how it works lah. It comes into contact, it enters the body. If it gets into the bloodstream, that is the most dangerous part because it will become systemic. So if it gets into the bloodstream, because the blood circulates throughout the body again, so it will be brought to all parts of our body lah, right, and metabolized, and will go to target organs before it is excreted. All right, so similar concept here, whether it's excreted or it will be stored in the body tissues or organs, and it can cause diseases. So that is when you realize that, how come am I, I haven't had this kind of disease for 10 years, 20 years working in this workplace setting, but how come now only I get this kind of disease? Okay? So maybe because it is being stored for a long time. Okay, and the health effects can be classified by various categories. Okay, first one is by the parts affected. It can be localized, it can also be systemic. Systemic is like what I said just now, if it gets into the blood system. Local is like ni lah, skin irritation. Okay, or dermatitis ke selalunya, if you spill it onto your hands, then you can see it on your hands. Okay, but it can also be like like this. Okay, if it gets into the lungs. It can also be classified by duration of exposure, where you can be exposed to it acutely or chronically. Okay, acute is short term, chronic is long term. By time of exposure, whether you can see it, the effect immediately or delayed. Okay. Some effects can be reversible, some can be irreversible. If it is reversible, then it is okay, right? Not so bad. But if it is irreversible, it means that it will, stay there. It's just like exposure to asbestos. Okay, asbestos is very, if you look under the microscope, it's sharp, right? So once you inhale it, it will be stuck in your lung. It will never come out. Okay, and it will cause scarring of the lung tissue. Okay, other than that, it can be by target organs. Okay, depending on what's preferred lah. Target organs maybe it goes to the blood, the neuron, okay, to the kidney, to the liver. So it is up to the compound that you are exposed to. And special effects can be, it can cause allergic reaction. It can be carcinogenic that causes cancer. It can also react with DNA, and that is called genotoxic effects.
There's one question by Nahid Parvin. So what shall we do to prevent environmental exposure?
Environmental exposure. Okay, because it is environmental exposure, it is very hard for us to control because it is around us, whether you like it or not. I would say staying at home, maybe, but that sounds so lame, right? But well, that's the truth lah. It's just like the situation that we have nowadays, COVID. Okay, you know that it is out there. So the best part to do it is by eliminating, by staying at home. That's why we say stay home, hashtag stay home. Okay, because if you go out, chances are you will be exposed to it. Okay, but if you go out nowadays for the COVID situation, you might be wearing mask. But if you are talking about exposure to smoke, for instance, it is not common in our country, like a few years ago before COVID era, for us to see people wearing masks in the public. Okay, and for all we know, people wear masks only when they are at work. Okay, but if you travel to developed countries like Korea, like Japan, okay, it's pretty common to see people wearing surgical mask, surgical mask saja. Even though there is no outbreak, it's just because they are concerned of other people's health. If they develop symptoms such as flu, and they have runny nose, So they don't want to spread it to others, and they wear mask. So this itulah maksudnya there is a chance for environmental exposure. Maksudnya dia spread kepada orang, to the environment, and it will be spread to others as well. Okay, so just have to be responsible where necessary lah. Dekat Malaysia ni it's not common yet, but after the COVID-19 situation ni, I guess it may not be of a big deal sangat lah. Okay, so in terms of exposure, you have to understand how much are you exposed to it. Okay, so this is where dose plays the role. Okay, so dose is like when you take medicine lah. Okay, it's just that medicine too is to cure our diseases, but dose in this case is like what are you exposed to in terms of what is bad for our health, right? And in this case, given the body size, okay, large dose will cause large effects, right? If we are of about the same size, okay, of about the same body weight, okay, maybe say if you are 60 or 65 or 75 kilos, okay, so effects too. If you give the larger dose, of course, the effects will be greater. But for same size adult, okay, you can see same size adult, you can see different dose, ataupun same dose to adult and baby. Okay, can you give the same dose to adult and baby? If you are talking about medicine, of course not then. Kalau kita tengok kita nak bagi medicine to our children, we have to follow the dose. It's 5 ml ke, okay, but for us, of course we cannot, cannot take 5 ml. It's not enough for us. Okay. Conversely, if you are talking about exposure at workplaces ataupun in the environment, okay, if you go out there, okay, you are exposed to dust, for instance, by standing by the roadside. For us, it may still be tolerable, but for the little children, they are very vulnerable and they can easily get, sore throat and such. Okay, so for that, we have dose response. Dose response ni, at workplaces, it's very important for us to understand the threshold dose, in which that is the minimum dose, okay, that produces a detectable degree of any given effect. Maksudnya that is the minimum dose that that begins to start showing effect to us. Right? For instance, we may be exposed to chemical ataupun gases lah, in our workplaces. But in little amount, we might not even feel it, right? But as it increases, the concentration, then only we will start to smell it. We will start to feel uncomfortable. Okay, maybe you feel irritated on your mucous membrane and so on. Okay, and in workplace setting, it is very common for you to understand what is little dose. That is LD50, or sometimes you will also find the term LC50, little concentration 50. And that is the dose that is required to cause death ataupun effects in 50% of the exposed population. Right. For instance, if you expose 100 mice, okay, to a certain type of chemicals, right? You test it at this concentration, right? And then you see the effects on the mice. Maybe if only 20 mice die, okay, if they die, then that is not considered as LD50. You have to wait until 50% of the mice is dead, then only it is considered as LD50, right? So that indicates the substance acute toxicity. All right, here I have a table of LD50 of various compounds, and if you see here, LD50 for ethyl alcohol is 10,000 milligram per kilogram of body weight lah. Okay, and if you look at dioxin, it is 0.001. Okay, so from those two lah, comparing those two, which one is more toxic?
Any
So is
response?
it ethyl alcohol or dioxin? Obviously, it is dioxin, because even in very small amount, it can cause death in 50% of the population, right? So don't be fooled by the big number there. Okay, so it's very important for you to understand those. If you are dealing with chemicals at your workplaces, check the safety data sheet, okay, because it will definitely show the LD50 or LC50 value, so that you know that you can get all these kinds of occupational diseases if you are exposed without protective measures.
So can I
Right.
say, doctor, that this LD50 will be the baseline, right? For the baseline to show the effects of toxin at the workplace.
All
Can
right,
it be used as a reference?
LD50 can be an indicator, right? Because in workplace settings, by right, you should follow the permissible exposure limit, okay, that is set in the standards and regulations. Okay, because that is when you have to know how much are you allowed to be exposed to. But that standard selalunya akan, will be reflected against LD50 juga lah somehow. Okay, but that is a good guidance. Okay, bear in mind that regardless of whatever that you are exposed to, okay, there are variabilities, okay, of human exposure. Sometimes we feel that it is normal. Just like I said, our surrounding may be a bit dusty, okay, your workplaces or maybe your home may be a bit dusty, but that is, to us, that is normal. Okay, but if it is, maybe a bit more dustier, maybe we can still adapt to it, right? Because of our body immunity, just because we are just used to it, right? But under some circumstances, it can cause diseases, okay? And to some other people who are more vulnerable, okay, it can cause death, even in the same situation. Okay, that is also why if you observe closely, if you think about it, those who are in ICU, they are not allowed to get visits from outside visitors, okay, because they are very prone to they are very vulnerable lah, maksudnya even someone one of the visitors come coughing, it can infect them, okay, whereas to us, if someone coughs next to us, it's like it's just cough, okay, in our normal situation, right? So everybody is unique. Okay, some people may show no effects at all. Okay, some people may be seriously ill, or some people may, be dead ataupun dapat cancer due to the exposure. And speaking of the vulnerability of population, these are called the sensitive subpopulation. Okay, in which it covers the population who are young, or little children, who are chronically ill because they do not have the same body immunity like we do, we normal people, average healthy person. Okay, those very old people, okay, frail, pregnant women, and also women of childbearing age. So that is why employers should also consider excluding pregnant women, okay, to work in certain departments, okay, if necessary. If you have pregnant employees, okay, coming to you, saying to you that they are expecting, so you might want to exclude them and transfer them to a different department doing a different type of job. Okay, so you as workers, you should also know your rights, okay, so that you can demand to be protected at workplaces as well. Okay, anyway, all this can be affected by age, by weight, lifestyle, and sex. Okay, so depending on all these factors, it may vary. Okay, types of exposure, like I said just now, okay, that is acute and chronic, okay, somewhere in between, subacute and subchronic, just for you to understand whether it is acute or not. Typically, if you can see the effects within 24 hours, that is considered as acute lah, immediate effect. But if it takes more than 3 months or so, that can be considered as chronic, because the symptoms may develop and then it may accumulate from time to time before it shows the effects. Okay, so what do we do about it? The key in reducing exposure is by practicing ALAP. Okay, ALAP stands for as low as reasonably practicable. Okay, so we want to keep it low, although you know, you may already wear PPEs, okay, but it is always best to keep it low because you'll never know during emergency situations if anything fails. If you wear PPE but you don't properly fit it, okay, so it doesn't protect you, okay, or if there is any leakages, okay, the gas leakage, okay, so if you do not protect yourself, you will be exposed to it. So it is always good to keep it as low as reasonably practicable. If there are standards, then follow the standards. But it doesn't mean that you know the standard is 50 ppm, for example, okay, and then you feel like your exposure is 48. Okay lah, 48 is enough lah. Okay, if you can reduce it further, then reduce it further because you'll never know when things can go wrong and you can be exposed to a higher level. Okay, and it is also important to know that there can be significant exposure from short exposures on daily basis. Okay, do not take things for granted. It has happened before in which workers deal with solvents. Okay, they just have to deal with solvents for like 15 minutes a day just for cleaning purposes, and to them it's like just 15 minutes, that wouldn't do any harm. Okay, but 15 minutes times 5 days in a week times, you know, how many years that they have been working dealing with that thing. So just imagine how much has accumulated into the body. Tahu-tahu je dapat penyakit, tahu-tahu je mati. Okay, and we don't want that to happen. All right, so with that, I guess we can summarize that there are causal relationships in occupational health. You just have to know what are you exposed to and what effects does it bring to your health. Okay, you have to understand the dose-response relationship. The higher the dose, okay, the larger the effects, but depending on the body weight, okay, and other factors as well. You have to understand the routes of exposure, okay, that it can get through other, you know, other channels as well. Okay, don't just think that when you inhale it, then only it is by inhalation. Carbon monoxide, for instance, it is a silent killer. It doesn't have any smell. Okay, you may be inhaling it, and then for God knows, so you collapse. Okay, and then to reduce the exposure, always practice lah. Okay, and I guess that's all from me. Well, that's my number and my email address there if you have any questions later on. But for now, I would like to welcome any questions from Lola so we can address it right now. Thank you.
Thank you, Dr. Ismail. All right, so thank you for the wonderful explanation regarding the basics of toxicology. So doctor has covered the concept of causal relationships, toxicology, pharmacokinetics, right? Exposure or the degree of exposure, the doses that we need and suitable for the patients or people who are affected with the toxic, and also the concept of ALAP, right? Somebody asked me just now, is ALAP means as far as possible? So you have already answered that just now, right?
Yeah,
so what's your opinion on that?
It is pretty much similar as far as possible, right? Lebih kurang lah, I would say that. Okay, it's just that in terms of regulation, they call it as low as reasonably practicable because practicable ni can be in terms of cost, okay, in terms of apa lagi, technology, okay, because you may want to do something that is achievable. You have the idea of, okay, maybe we can protect the workers by installing this, implementing this, but it may not be practicable because the technology is not available. Ataupun if the technology is available, but the employer said, oh, sorry, we don't have the funding for that. That they do it nak implement benda tu. To install robotic welding, for instance, because welding by manual welding yang biasa ni, workers will do it, kan? Okay, but you feel like macam, okay, that will expose the workers to welding fumes. Okay, so why don't we have robotic welding? Nak pasang robot, berapa juta pula nak kena invest, So the bosses say that tak boleh lah, no, that is not practicable. not practicable in terms of cost lah, macam tu. So practicable can be, in various ways lah.
Right. So perhaps if there are any questions that you would like to ask with regards to today's presentation. Now, there's a question from an anonymous attendee. Now, when exposed to toxics, what are the easiest things to do when you are alone?
Alone.
What are the easiest things to do when you are alone?
All right. First thing first, if you are talking about in a workplace setting lah, I assume this, you have to adhere to whatever safe operating procedures, okay, that is implemented by the employers. Okay. For instance, okay, if there is substitution, okay, you can use less hazardous chemical, then use it. Okay. But if it is not possible, okay, there's no way to substitute, maybe there's a fume hood. Okay, you can work on your bench, okay, but there is a fume hood. Then turn on the fume hood and do your work in the fume hood. Okay, because that is always a better option. Okay, that is an engineering control kalau ikut hierarchy. Besides just wearing PPE, do not feel like okay, it's okay, I can just do it on my workbench, okay, and wear the PPE. Okay, because if it spills ataupun ada anything wrong happens, then you will only rely on the PPE that you wear. Okay? PPE itu pun kalau you pakai betul. Okay, if you wear it incorrectly, the wrong type, okay, or maybe it's not well maintained, then chances are you are exposed to it because you are alone. But if you turn on the fume hood, you work in the fume hood, okay, it will be whatever emission will be sucked out, okay, then will be treated lah. So that is why it is of a higher hierarchy.
All right, thank you, Doctor. Now, ladies and gentlemen, in the chat box, there is a evaluation form for you to fill in. Now, please fill in the evaluation form. All right, the address is, if you can see, the forms.gle bsc pvcg fu qzychfr5. Now, that is the form for your evaluation. So I really hope that you can fill in the form, because when you have already submitted the form, the e-certificate for today's session will be emailed to you immediately. Right? Please feel free to fill in the evaluation form so that the organizer can email to you the certificate for today's presentation. All right. Okay, that's a bit of announcement there. Now, do you have any other questions that you would like to ask? So there's a lot of thanks to you, Doctor, from the
Thank you
participants,
very much.
right? So they've recommended you, what they call this, praise you for the highly informative webinar session. They've learned something from today's session. Okay, I'll open for another one question or perhaps two questions. Now, besides the form, right, the form that you already seen with regards to the evaluation, there's also another form that perhaps you can consider to fill in. All right, it's called the Survey on Chemical Productivity Nexus. Right, the Chemical Productivity Nexus. Now, this survey is to look into the opportunities and also the assistance that can be given to you as chemical industries practitioners. So please feel free to look into the form and fill it up and submit it to us, right? So that we can do the necessary arrangements or follow up regarding the what they call this, the help or the assistance that we can give. Okay. So please, if there's any question, right? So at the chat box, two forms to fill in. One, the Google form, and the other one is the survey form. Survey form for the chemical nexus. So thank you from, all right, again, from all the participants, all right? So they, from Marisa, all right? Okay, from the rest of the participants from Sherry, from Airo, from Annalita, and so on. So some of them, I think, are also from overseas, from our neighbor countries. So if there's no question, anything that you would like to add, Doctor, before I close the session?
All right, I would just want to say thank you very much for the opportunity for this knowledge sharing. And please, if you feel like you are interested to know, okay, there's some sharing on the chat box there. But the next session, inshallah, will be on identification, classification, and SDS of chemicals, right? So if you are keen to learn more on this, okay, feel free to register. Okay, so I might see you there, or maybe my colleague.
All right, so let's meet again in our next session, identification, classification, and SDS of chemicals. Dr. Isma will be here again to explain to you with regards to that subject matter. So thank you very much, ladies and gentlemen, for being with us in this session. And the second session with Dr. Isma will be on the 2nd of March at 3 p.m. Malaysian time. So see you again during that session. Oh, there's somebody from Dr. Tilotama from India. All right, she also said thanks to your session just now.
Thank you very much.
So we hope that we can meet again on the second session on the 2nd of March at 3 p.m. Malaysian time. So thank you very much for attending this session. At the end of the day, hopefully our vaccine will go smoothly, all right? And everybody will get the benefit from the initiative. And as a word of to close this session today, I would like to always remind all of us to stay safe. Kita jaga kita, lindungi diri, lindungi semua. Sekian, wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi wabarakatuh, and have a nice day. Thank you very much. Bye-bye.
Thank you. Bye.